Hello, 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 hello. Just give me 1 second here. Okay. Hello. Happy Tuesday. Welcome. My name is Abby Tyler. I am your host. I'm a practicing family nurse practitioner, content creator, and community health volunteer. Welcome to my Tuesday show. As you can see, the title there is Mental Health Awareness. May is Mental Health Awareness Month, and I'm going to be talking about depression in women. Okay, so I am just gonna once again, just gonna make sure that I am live. Just gonna share this video, please. If you're gonna be watching now, please share the show. Watching later on, please share the show as well. So I'm just gonna go right here and I'm going to share, and I'll be right with you guys. Okay. Alrighty. So welcome, 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 welcome to Abby Tyler's Healthy Living. I am going to be reading my notes over here. So if I look down, please excuse me. Okay, my name is Abby Tyler once again. Welcome to my Tuesday show. Today is talking about mental health awareness and depression in women. It's not May 17th today. It's been so since the beginning of this month. There's been so many different podcasts talking about mental health awareness, and I've seen different shows, whether it's our community, meaning Liberian community, anybody else that been doing that. So I see you guys have seen a lot of it. I don't want to be repetitive, and I also don't want to make it to where it's so broad that most people cannot understand it. So I'm just going to just concentrate on one of the main things that the ones that I see more in my practice. Before I do that, I also want to say there's more to mental health than just depression and everything else that you guys see on TV where you think this person is going to do something and cause something problems and all that. So there are many different types of depression also. So I'm not going to make it that broad. This is not completely comprehensive. There's no way it can be comprehensive in a 30-minute period. So, but like I said, there are more other things that fall under the umbrella of mental health awareness. We're talking about bipolar disease 1 and 2, schizophrenia, schizoaffective disorder, anxiety, depression, people who self-medicate and end up having substance abuse issues, OCD, uncontrollable compulsive disorder, resulting also depression resulting from trauma, and also other depression that also results from other neurological diseases too, because sometimes if you have a stroke, depending on how that works, other things can cause depression. So it's so vast. It is so vast, and the whole team, the psychologist, the psychiatrist, the family nurse practitioner, the mental health nurse practitioner, all of that working to that PA and all. So let me say my disclaimer again: whatever I say here and discuss here is not for you to go and change any of your regimen. Please make sure you are checking out with your family physician and your family provider before making any changes to your regimen. Okay. And once again, I'm not a mental health specialist. I'm not a psychologist. I'm not a psychiatrist. I'm not a trained pediatric, I mean, mental health practitioner, but I am trained to recognize all the symptoms and also to treat. And I also prescribe medications too. So I'm just as responsible for taking care of my patients who have mental illness. I treat them, I medicate, and I also refer when it's indicated. Okay, so I'm just give me 1 second here. Let me change myself. So my flyer on the paper that I had my ad, I had these two people on there. So right now, the one on the top there, there's Chesley Chris. She was the former Miss America, former Miss USA, and also a lawyer and correspondent on TV show. And the one on the bottom is Naomi Judd. I now people might say, why are you picking people who are celebrities? Unfortunately, we live in a world where if when things happen to celebrities or well-known people, that's when a disease is pushed to the forefront. It's not fair, but usually that's what the case. And because of that, we get to know more about it. Chesley Chris, I got to know her when she was one of Miss USA, and Naomi Judd, I got to know her when I first came to America, and I used to watch country music and I used to listen to the Judds. And her first song, that's not the first song they made, but the song Grandpa, I used to love that. So I followed them all through, and then her daughter Ashley also, who are in show business. So I followed the family during that time. And it's just sad because both these people had severe depression. Some people are born with chemical imbalance, and some people again they suffer over time. So, like I said, there are a couple of different type of depression. I'm not going to get too detailed into it because mental health is not something that's so simple that you can just break down easily. So, and it's something that we don't like to talk about in our community because we, especially in like the African community and also in the African American community, because for the longest time we weren't allowed to be vulnerable. Okay, you didn't have the option of being vulnerable or the luxury of being vulnerable. You're busy just surviving. But it's at a point right now we're recognizing more that this strong black woman, this tough black woman, and I got Jesus on my side and I got God on my side. I have nothing against religion, but even if somebody who is a trained pastor, a trained religious leader will tell you you need therapy. You need to go to therapy. You can still pray, but you need to go to therapy. Okay, I already listed all the other different mental illnesses, and also when it comes to depression, especially severe depression, you need therapy. Okay, so also doesn't mean everybody who's have mental illness or depression we end up in any let me change my banner here. We end up with having suicide. So that's way past that. Just because, like I said, I pointed them out because the fact that they're the most known people right now. Regina Hall, it's a Regina. I can't remember her name right now. I can't remember the last name for some reason. Anyways, she was the ones who were from 227. Her son died recently. So there have been so many other people. Anthony Bourdain, who was the chef, he was on CNN, and so many people. So there's so many reasons that it can happen. So I'm just gonna go into that. I'm not gonna delay this anymore because I don't want it to be too long. And then I'll get to questions later. Okay. So so I've told you about it already. So okay here. So some of the tools that we do when you come into the office, we're doing that now for everybody because usually people will not come in and say they're having depression or they're depressed or they feel that because some people just won't. So we doing this is the diagnostic tool, the basic diagnostic tool that we do in family practice. There are many more. If we need to go do more, we do that. But this is the one the basic diagnostic tools that we do in the family care practices. Okay, so it's called a PHQ-9. Okay. Let me just change my screen here. Okay. So let me just go over a little bit of it. I tell you. So over the last 2 weeks, if you answer yourself these questions, if it's zero, it's like minimal. If it's more than that, and I'll go over the skill with you. So how often are you bothered by any of the following? Okay. So zero is not at all. So listen to that. Zero is not at all. Several days is one. More than half of the days, there's two. And nearly every day, there's three. So three is bad. Zero is like minimal. All right. Do you have little interest or pleasure in doing things? How many times a week? Okay, over the past week. You feeling down, depressed, or hopeless? You trouble falling asleep or staying asleep or sleeping too much? You feeling tired or having little energy? Poor appetite or overeating? Feeling bad about yourself or that you're a failure or let yourself or let a family member down? Trouble concentrating on things such as reading the newspaper or watching TV? Moving or speaking too slowly that other people could have noticed? Or the opposite, being so fidgety or restless that you have been moving around a lot more than usual? Thoughts that you would be better off dead, especially that one. Thoughts that you would be better off dead or hurting yourself in some way. So again, like I said, over the last 2 weeks, alrighty. So 0 to 4 is minimal, 5 to 10 is mild, 10 to 14 is moderate, and 15 to 19. I'm gonna put this PHQ now. I'm gonna put that in the comment section there too, so you guys can look it over. So usually that's, like I said, that's the basic tool that we use to when we do that. And then if I see that, when I go through that, if I'm taking care of the patient for many other reasons, but I do see that sometimes we do it like every visit, and sometimes we do it maybe periodically, but everybody gets that. Now, every new patient, when I see that, I make sure we talk about it at that part into my examination and the history of present illness and all that. And then I probably will refer, and if I need to give the patient a medication or stuff like that, depending on the numbers, or if there's anything that's really serious on there, I also ask, are you having any suicidal or homicidal ideations? If it's really severe, then I'm calling the crisis center right there. There's no going home. You calling the crisis center because by law we have to do that. And sometimes the patients just say no. And when they go home and then I sit there and I'm like, I pray that no meant no. But if there's anything, that's when we ask those questions, and we ask more than that. Okay, so I'm just gonna bring it down now to depression in women. All right. And Friday, I usually do Fridays chat with Abby. I'm gonna do depression in men, so I can just finish up the mental health awareness. Okay. So there are some, let me go through it now. So there's some biological traits that make women more predisposed to developing depression, mainly the female hormones like your progesterone and estrogen that affects your mood and imbalances. And if it's imbalanced, you can have issues with that. So over time, that genetics and other things that can follow there. So symptoms of depression. Okay. Now these symptoms they don't fall with everybody, and it's not all of it. And once again, like I told you guys before, there are certain illnesses that symptoms that mimic other diseases too. So it could not just be, sometimes when the patients go somewhere and they be like, maybe you're just depressed. Some provider may say, maybe you're just depressed. And it could be something serious that's going on. But, a good provider, and over time, the more we see you and the more we look at your full history and do everything, we can pretty much guess what's going on there. Not guess, but we can probably deduce what's going on. Okay, so symptoms in women. So your physical symptoms: increased appetite. Now, I said depression can cause physical symptoms. These issues may or may not be related to any medical. Okay. Again, like I said, sometimes it mimics other things. Constantly feeling sleep deprived, even with plenty of uninterrupted sleep. Pain such as muscle aches and cramps. Digestive issues like you're feeling like stomach bloating. Sometimes you may have like diarrhea. You may have constipation, fatigue. You're moving or talking too slowly. Feeling very restless. You're having trouble remembering or concentrating. So basically, we're going back to what the PHQ, and these can also happen with men too, but we're just talking about women today. Emotional symptoms. Emotional upset can be a common trait of depression in women. These feelings can be chronic and can be intense at times. Feelings of hopelessness, worthlessness, guilt. As women, it's like you're always feeling guilty for something you think you did wrong to your children, or something you did, and you look back and like, oh my God, did I do something? Did I hurt their feelings? Did I do this? And then sometimes, depending on the time in your life, what you're going through in your life, you feel like you're never going to get out of where you are. And sometimes that comes on over time, but some people just have that all their lives, and they need to be in therapy for this. Okay. Irritability or restlessness, difficulty making decisions, you loss of interest in your hobbies and activities, things that you used to like doing. Like some people like to be on social media, some people like to hang out with their friends, and all of a sudden, not all of a sudden, but over time, you stop doing that. The same way when we talk on Facebook, like I see somebody who's like always happy and jovial and everything on Facebook, and then I don't see them for a couple of weeks, and then it looks like 3 weeks, 4 weeks, and you try not to get into that business. So every once in a while, maybe like, I don't know what you're going through, but hope everything is okay. And then sometimes it's just, oh, I'm taking a break from there, and just trying to like do something else right now, so I'm not on there. Because like, again, I said, like Facebook or whoever social Instagram, people, places that you have like committed friends, not just like TikTok where you can have everybody, but it's almost like a social neighborhood. We have this all little neighborhoods that we are all in. So basically, when you see somebody posting or you see somebody responding to other posts and all, it always seems like you're in a little neighborhood where you see people coming in and out of your house. So if you're in a neighborhood and people coming in and out, and you don't see somebody coming out for most of the time, you're gonna get concerned. So usually that's when people say, okay, I'm just checking them and just making sure if you're okay. So when people do that and not being nosy, of course, there's some people who are being nosy, but you can always tell the ones who are being very genuine and say, I'm just going to make sure that you're okay. I'm just checking to make sure you're okay. I haven't seen you around for a while. I mean, sometimes, like I said, I used to get on Facebook maybe 3 to 4 months at a time when I was in school, and people used to check up on me. And there's nothing wrong with that. You can usually tell who the genuine ones are. Okay. So thoughts: loss of interest, difficulty making decisions, loss of interest in hobbies and activities, like I said, and thoughts of suicide or death or attempts of self-harm. Sometimes they don't want to kill themselves. They say, when I ask you, do you have suicidal or homicidal ideations? And they say, no, it's like, I don't want to do that, but I just don't care if I'm alive. This is one of those things where it's like, okay, start listening to reading the red flags and start saying that, because we have to know, okay, which one that says, yes, I need to call the crisis center, or I need to refer you over to a psychologist, to your therapist, and give you some mental health resources to make sure that you're following with them, starting your medication. So, and those things we have to know to know when to say send to the ER, to the crisis center. All right. Okay, so causes and triggers. There are a variety of causes and triggers that cause depression in women, as well as episodes of existing underlying depression. Okay. Not all of them, it is not exclusive. And again, this is not inclusive. So some of the things that women go through that mainly fall along the hormonal line, menstruation. Some people have depression every time around when they see their period. It's just they get to the point where it's like they're just laying around, they don't want to do anything, and but they're still doing it, so functional, going to work and all. If it gets to the point where around their period, which is more like it's called premenstrual dysphoria disorder, where they're like very angry or they're like visibly just laying around, don't want to do anything, anxious or time or oversleeping, not doing that, then they definitely have to, you definitely have to speak to your GYN and your family doctor, your GYN also, and then they can, you probably have to see your therapist after that, because that's not normal. Feeling a little depressed or feeling a little anxious around your period and other things like that, that comes with some people. Some people have none of those symptoms. But if it's something that's bothering you over time, then of course you want to bring it to the attention. And I always say, like your family doctor, we probably gonna be the first line of seeing these things before the other specialists see them. Okay. Okay. Menopause, when you're become menopausal, and most people start getting menopausal, start getting symptoms like around maybe 40. Some people can go as early as 40. So it's anywhere between like 40 and 55 when your hormones and everything, your progesterone, estrogen levels start going down, and all of this shift in balance and everything that comes along with menopause. Weight gain, sometimes a little bit of memory lagging and other things, and just the differences in where you find yourself at that age where, okay, I'm 45, I'm 50 years old, I'm at the point now where I probably got maybe 40 good years left. And I'm being very generous, especially if you have chronic illnesses and other things you have to worry about. So all of that can cause problems. And those are things that are unique to women. Okay. To women, pregnancy and postpartum. People have pregnancy, postpartum depression. There's also antepartum depression. People get, their hormones, because their body is like this. I spoke about that in my thyroid thing. So you can go back and watch my thyroid video. When you're pregnant and all these hormones and the body's demand for the baby, and if it's not your first child, even if it's your first child, everything else that's going on in your brain, and people say you got baby on the brain, there's so many different hormones that are raging through your body, and your heart is pumping out more blood because you need to get this baby, the liver, the kidney, everything else, and then everything else that's going on outside of the pregnancy. All of that can lead to depression as well, also anxiety and everything surrounding. If it's a safe pregnancy, if it's a safe relationship, all of that can have issues. You're in there already. Postpartum depression. Most people have postpartum depression, and it's usually when you wake up, when you have the baby, it's like, okay, you're just sitting around for a while, you don't want to get up and get freshened up today. That's different. But if a couple of days, couple of weeks go by, and in the afternoon you're still in your bathrobe, you haven't done your hair, you haven't, the baby is crying, you haven't tended to the baby or taking care of the other children in the house or all the other responsibilities, and you're not, when usually they tell you, so when you hold the baby, do you feel anything? And now everybody's maternal, so it's not, you feel the baby, do you don't feel any, as long as you don't feel like hurting the baby. That's also very important too, because when you go see your GYN and also the pediatrician, they're going to be asking you those questions. You feel the baby is crying too much? Do you feel like your life, you don't have most of your life because the baby is crying too much? How can we work around that? Okay, a pediatrician, midwife, or whoever it is that you're seeing after that, and your GYN, so would be discussing that, because also, and some people, babies never to say, okay, now, especially now with the formula thing that's going around. Oh, okay, no, people say, oh, if people just breastfeed and now everything will be fine. People just breastfeed and be fine. We won't have to worry about this and that. Not everybody can breastfeed, and not everybody can latch, and not every baby can latch on. So would you sit there and try to force yourself, try to breastfeed this baby, and the baby is not latching on, and you're in, a lot of people, a lot of women have like severe pain in the nipples area, and all of that, if it gets infected or very, is really, really painful, you're not going to tell the person, oh, just go through it. Just go through it. And before you know, everything will be fine. Sometimes if you get the baby to suck on frequently, that can ease the pain. But sometimes some baby cannot latch on it. So will you like the baby and, sit there and starve, especially when they tell you you're supposed to be watching and make sure the baby has at least 10 to 12 wet diapers a day. Should have at least 3 or 4 bowel movements a day. And if none of that is occurring, that means the baby is being malnourished. All of that can lead to depression, and in addition to everything else that comes along with the hormonal changes after you become pregnant. Okay. So that's very important to keep an eye out for that. So these are things that are uniquely female. And also genetics. If your mother had issues with depression and all, that's always a higher chance that you may be depressed. At the same time, chances are my generation and the generation prior to mine didn't go to get help either. I mean, back then it wasn't something that people went to. You either prayed away or you just thought, okay, maybe I'll just live through it. And depression wasn't something almost like seen like you're being lazy or like just get over it. You're happy, you have roof over your head, you have food on the table, you have a good husband, you got a good wife, you got good this, you got good that, and your children. Okay, what do you have to be depressed about? Like I said, some people are born with their home that imbalance, and they need to work on that, and they need help. Okay, so we move on from there. And chronic health issues. Again, like I said, if you have chronic health issues, that can always it really maximize your and also make you a potential risk for having even more severe depression. If you have, let's say, you've had chronic pain, that's one of the things that can always make people, because let's think about it. You're living your life and you go about your business and all that, and you develop an illness or something that caused you to have chronic pain, or you were in a car accident, or you're in any kind of accident that caused you to have pain. And most people don't understand. They'd be like, oh, well, wait a second. You just take a little bit of medicine. Are you drug seeking? Are you doing this? And that is not the case. The person is, especially if you're having nerve pain, is one of those things that people they can't see. They'd be like, well, you didn't break your bone, or if you hurt yourself, you already went through therapy. You already did this. Why are you still in pain? I mean, just stop taking the medicine. You're doing that, and it's just making you this way. And you can't go to work now because you say this pain. I had the pain before, mine went away, or I just dealt with it and I prayed it away and all. No, no. Chronic illness can really affect your mental capacity. So when the patients come to even the hospital, and they come to the doctor's office as well, we also rate their pain. So do you have general pain? Where is the pain? And also, is the pain being managed? How does the pain affect your life? And some people may say, oh yeah, I'm getting little aches and pain, little aches and pains here and there. That's different. But chronic pain from resulting from, and like I said, injury or anything else, sometimes it can be cancerous pain and all. That also can cause severe depression. Go in there. Chronic pain, depression, and also other medical disorders also that can trigger the brain. Let's say if you can be taking some other medication for something else that can also trigger depression. So, and also the fact that when you're depressed and then you cannot function not function as a female, but let's say you can be intimate with your partner and all, and if your partner doesn't understand all that, that can even make the depression worse. Okay, because they'd be like, oh, you're there, you're just laying around, and the man doesn't have. What do you expect the man to do? And no, you should, especially when it comes to that, please be careful who you discuss that with, because the people will give you so many different ideas and so many different excuses or so many different reasons to sit there, and they're just going to put you over the top. So be very careful when it comes to discussing your intimate life, who you discuss it with. Okay. And sometimes people have other issues. You have surgery and you have things that make it that you cannot do certain things anymore. That can also cause depression, which is normal. And most people don't know that. So again, talk to people who really believe in you, who really want to support you, and who will give you the idea, will be objective, but also be very sensitive to your plight. Because not everybody's going to understand. Even your closest friends, they may not understand everything. So you can have a lot of friends, but you have to know which friends you discuss everything with. Like I always tell people, you can't tell everybody everything. Okay, there's be certain friends where you can take to the Met Gala if you got invited, and there's certain people you can take to somewhere to the park. You can't take everybody everywhere, and that same way you can't tell everybody everything. Excuse me for a second. Okay, so also the hormone I told you, the thyroid, I talked about that in my thyroid show. Anything that's going on, they have to do some testing to make sure nothing else is going on there. Okay, I already talked about sexual dysfunction, because some medications can also lead to low sexual drive, which can also affect people, and some other psych medication can cause other issues too. So you and your provider would discuss this more often. Okay, and I already talked about a cancer diagnosis. If they tell you have cancer, I mean, everything that can go through your brain will go through that. And when you have issues with cancer, that affects the entire family, because you're talking about the whole treatment and how long the treatment will be, and everything else that changes your work, your family lifestyle, everything that changes because of that cancer diagnosis that can bring on. So most of the time, most places that have issues that take care of cancer patients and all, we also have like a cancer navigator at the hospital, where she went and she worked along with the oncologists and hematologists, and worked with the patient, and work with the nurses and the social workers, and made sure that patient had everything that they needed before going home, and also back and forth when they come back for treatment. And also she kind of did the go between, so which was really helpful, because before that wasn't there, and patients felt like, oh my God, they just gave me the diagnosis and I'm out there in the world, can do that. And most doctors office also have that too. They have access to social workers and everything to work through that. Aging also, when you, as you get older, you age, you also get depressed as you get older, because think about it. I mean, people, when I sit there and talk to an older person, I'd be like, oh, they don't have that much to worry about. That's what they worry about, the mundane things. They don't no longer have anything to worry about. I mean, they're not worried about going to work. Not worried about the children being little. They're just there, especially some older people. They sit home. There's nobody there to talk to them. Their kids are all grown out of their house. Maybe they're a widower, and they're there and they're watching TV and nobody's around, and it's quiet in this house where nobody's around anymore, and everything that they used to find fun doing, their physical ability is no longer there. So that alone can lead to that. And also the physiological part, where if you have if you start developing any kind of dementia or anything like that, memory loss, that can also have big effect on with as far as depression. Because when you say, there's somebody saying, didn't I tell you that before, didn't I? And you can't remember certain things, of course after a while you'd be like, okay, you don't want to be around people, because people start noticing that you're forgetting things, and that just puts you further into depression. All right, so let me just see there. I'm going to get into the questions soon. Okay. So I'm going to go there. So the ways women can cope. Let me just see my questions first before I go into that, because I'm already 26 minutes into this. Okay. So we'll start with Jackie Jackson says, so sad. And people are struggling with depression, anxiety, and don't have a strong support system. Some also don't have the just to go on people, so they just share their feelings and thoughts. That is true. That is true. You're a social worker, so you're part of the health team also. People have been in denial about depression, anxiety for so long, much because cultural differences. Trust is also a huge impact of such. Yep, because you tell people stuff, and our workplace also. Oh, I won't tell anybody. So that's why I said it's very important who you tell your secrets to, because not everybody can be the one you tell your darkest, deepest, and darkest secret to. Okay, and finding a good support system is key to your mental health. Yes, it is. Yes, it is. Thank you, Jackie. So I will go back here. Thanks for all your comments there. So, okay, so let me go back here. Alrighty. So now the ways that people can cope, all right? So non-medication, there when you talk to your doctor, and of course, like I said, your provider, and if you have to go see a therapist, the therapist usually is like they'll have therapy sessions with you. The psychiatrist is the one who will prescribe different medications, and also your family doctor can prescribe different medications as well. They all work together. Okay, want to feel your emotions, give into emotion, don't suppress it. You're feeling bad, even if it means like going somewhere in the room, empty room, or staying in the waterfront, or just shouting your feelings, get it off your chest. Don't hide it and don't keep it in, because the more you suppress it, the worse you're gonna feel, because I mean, you need to get it out. So be able to just don't suppress it. When somebody asks you, especially somebody that you trust, and they say, how you feeling, be truthful about it. Say, I'm not feeling well today. And don't do it where the person's like getting ready to go somewhere, and you say you're going to feel even bad, because the person might say, oh, I have somewhere to go right now, so I can't talk. Okay, so make sure you have enough time. I just say, when you have time, can we just sit down and talk? You can do that. Let's go out to lunch. Let's go for a walk. Because sometimes you don't want to sit there and talking to the person, looking face to face. It's better when you're just going for a walk, going shopping, or doing things that you can sit there and feel free to talk, where you don't feel pressure that you in this confined space to talk. That is if you're talking to somebody who's not a therapist or like licensed professional. Okay. And even then, you can talk about that. Certain doctors have their offices set up in different ways that make the patients feel more comfortable. Eat for your mental health, because when you're depressed, chances are more than likely you're going to be eating food that is not good for you, and you're going to be overeating at the same time. So then you start talking about weight gain, and you start talking about other issues that come along with unhealthy eating, other medical issues that come along with unhealthy eating, which just exacerbate your depression. So only eat when you have to eat. If it means for you to eat small meals along the way, go ahead and eat small meals along the way. All right. Jot it down, start writing, get a journal. I used to, when remember we were younger, we had our little diaries and all. You're never too old to have a diary or a journal. Write down the things that are triggering you, write down the things that are making you feel bad. So at least if when you do decide to go to see a therapist or something like that, at least that way you can talk about it. Look at the feeling, look write down things that are making you feel bad, the triggers and all that, what was going on. Write about whatever triggered it from the very beginning and what makes it even worse, what makes you feel better. Write that down. Write a diary. Do a journal every day and see where you are, and see, sometimes just writing your feelings down can help you get out of that mood, and also kind of help if you have any problems. And write down, you log down, if you, like I said, those who have problems when they have their menstrual cycle, write down what, every time, every month, do you find yourself getting depressed around your menstrual cycle? Write down the feelings that you're having, and jot down the time, and see, make sure, for those of you have regular periods, make sure, okay, this is when I notice in 2 to 3 days, when I start to feel premenstrual, that's when I start getting these feelings. Write it down. So when you do go talk to your family doctor, or to the GYN, and also the therapist, they can do that. There are many options, birth control and different things that can help, because you don't have to see your period every month, especially if you no longer plan on having children, or if you don't plan on having children for a while. You don't necessarily have to see your period every month. Okay, because like I said before, the body's primal need, female primal need, is to get pregnant every month. If you don't have to get pregnant a month, you don't have to get pregnant a month, because just imagine you see your period every month, and you get very depressed, and you get violently angry or whatever. That's going to affect your mood in the house. That could affect your family life and all. That could affect your job. So you don't want to be in that position. So if you don't have to be on your period every month, you and your doctor can talk about different options that can, and make that kind of remedy that situation, okay, or make it a little better, make it more manageable. Okay, get some sunshine. You know me, I'm always like out there when it's, especially when the weather's nice. Like, that's also, you can keep the lights on in the house. I usually, when I'm home, I open every window. I don't care what it's wintertime or whatever. I open every window until the sun goes down. Open the window, put the blinds up, put every light on when I'm close by, to making sure, because outside you're getting that natural vitamin D, and vitamin D kind of helps your mood and all. So when you're inside, put some nice bright light on, put the music on, just put something on that is stimulating your brain. Okay. So outside again, get enough vitamin D. So when you do get your blood work, we also do check your vitamin D level too. Yoga, or just meditating. I haven't done yoga before, but because when you're doing yoga takes, you have to do a lot of meditation. It takes a lot of strength to, straighten out your arms and looking at movements of your body, and all of that takes a lot of concentration, and it makes you come into yourself. I'm not a big yoga instructor or a big yoga person, but I usually, like I said, well, sometimes I just sit down and just meditate. And I don't meditate to where I close my eyes and meditate, because I know eventually I'm going to just drift off somewhere. So I just kind of think about it, and just, if I go to the waterfront or sit there, right? And but at the same time, all of these, you need to be talking about that, okay? And massage. Go to a massage, get your nice massage with the music and the lights. And also you can do your own massage. Take the lotion and just kind of rub your body down slowly with the music playing and all, because all of that takes concentration, and you're doing that. So that can also, but you can also go to a professional masseuse and get a nice little massage. All right. And they have cheap ones, so you don't have to go to something really expensive. Reach out to your friends. Again, talk to your friends who you really believe in. Talk to your friends who really love you and believe in you, and will keep your secret a secret. Except if you're feeling suicidal, please be honest. Okay. And if you're that friend that this person's talking to and they're having suicidal tendencies, please do not keep it to yourself. Tell the person, we have to get you help. We have to get you help, especially if you're sitting with them and they're telling you, oh, I'm doing this. And if they say that, call 911. Just call 911. Okay. Especially if they say they have plans and suicidal or homicidal ideations, because we say both of them, because sometimes some people, when they're having suicidal ideations, they will end up killing themselves and killing the family members, because they figure, okay, I can't leave my children here, because my children are just going to suffer. So let all just go together. And you know how tragic that can be. Okay, so making sure you bring that. For us who are professionals and all, we're mandated reporters, pastors, social workers, doctors, lawyers, teachers, nurses, doctors, all of them, PAs, NPs. We all are mandated reporters. Not to put you in trouble, not to say, okay, you're going to put my business out there. And most people don't want to go to the hospital, because they always think that's going to follow them. Their medical record's going to follow them. But that is changing. That is changing. If you need the help, you get the help. Okay. And get therapy. Okay, reach out to your friends and get therapy already. So if you have to do, there's so many different therapy. There's cognitive behavior therapy, psychodynamic therapy, but all of that, like I said, I don't want to make this too long, because that's too much information. It's just too much. Okay, if you do medication, your doctor, like I said, you come to us. We do the PHQ screening. We do more than that. We talk it over. I talk it over because you're your family. So mostly I'll be doing some medical stuff too. If we have to do some blood work, because it could just be some kind of imbalance going on, and once we correct it, you could be fine. So we check all that, and we look at the symptoms, and we can pretty much deduce whether the physical or mental, something that's mental health. And if we need to start your medication, we start your medication, but most of the time we'll tell you this is what we're doing. If it's really severe, again, we'll call crisis center, and then also we'll send you to mental health so to follow up and follow mental health. And then I also follow up too, because I want to make sure. And also when I start your medication, and most people can't find mental health, so most of the time what I'm seeing now, and I didn't appreciate it when I was a nurse, when I became a provider, is when I really understood the magnitude. There's not enough out there, and I'm going to go more into that on Friday. There's not enough providers out there who are doing mental health care. So you send patients, you say, okay, I'm gonna refer you. Yes, the number of different things. Even when I tell them, look on your insurance card, look in the back of it, and look and see if there's any more providers, because depending on where you are, you could be where in the suburbs and have like a lot of providers around, right? You can see somebody within a couple of weeks. And there are other places in the rural area or inner city areas where they're few and far between. So you could be waiting for months and months and months to see providers, especially during the time when we had COVID. So think about it, this person going through stuff and all, and you're the family nurse practitioner, you're going to have to start the medication and then tell them they have to come back every time. And some medication also increases the risk of depression, increases also the risk of anxiety, and also suicidal ideations. So you want to sit there and you want to tell them, I need you to come back like 6 weeks from now, because most of the medications don't kick in for a couple of weeks, and I need you to come back. And as a provider, I can't tell you how many times that I've started a medication on somebody, and I looked at them in the face and I told them, I said, please come back. If you have any problem, any suicidal homicidal ideations, please call 911. And I sit there and I literally, I go home and I sit there and I pray and I say, please, for all is good, and let that person just be okay. Let them be okay. And sometimes there were times where I first started and I would literally listen to the news, and oh, this person did this, and I would look and be like, oh my God, that wasn't my patient. And I look, and sometimes I say, okay, I want to see you back in 3 weeks. I want to see you back in 6 weeks. And I look in the schedule and I see that name on there, and I'm like, not so much that, okay, because of something I missed, but because I just want to be the one. I want to be the one to say, I'm in a position now that I'm able to care for somebody, that I'm able to help somebody, and I would hate for them to take the different road. As from what I'm training, I'm doing my best, and we can't save everybody. We can't. There's some people who they've gotten all the care, and they've got the best. They had access to the best of psychiatric care and everything, whether the person came to the house or like some of these big stars and all. There's just certain people, that we can't save anybody, and that's the part that eats at our soul, because you want to save everybody. You do your best to save everybody, but it's not possible. So friends, pastors, people who you trust and all that too, if you see somebody going through stuff, and you see people who are always, oh, so, and some of these symptoms, I can tell you right now, some of these symptoms, no symptoms at all. Those are the ones where you say, wait a second, she was so happy on Facebook, and she was so this, and she was this big person in life, and she had everything going, and she had a good job, and she had good this. Why did she have so much that she had to be depressed for so much that she had to kill herself? It's so much more than that. It's so much more than that. So show some people some grace, and show yourself some grace. So and like I said, I'm gonna finish this up with depression in men, because they also have different thing going on there. So the one thing I got this article too. So when I do my research on this. Okay, so I love the final view on this, where it says, I'm just going to read this verbatim. Each day may look different with depression. You may feel more hopeful at one time and be in despair at another. Give yourself grace as you would treat a dear friend. Acknowledge where you are. Be gentle and accepting of yourself, and reach out for help if you need it. Okay, so again, when I talk about men, depression in men on Friday, I'm going to talk in the disparity of not having enough healthcare providers around, and get some little bit of stats. But usually I don't like to go a little over this, but I just wanted to talk about that again, making sure that you check on your friends, making sure if you needed help, bring it up. Doesn't mean we're going to grab you and put you in some home or take away your livelihood and all. We just want to make sure that where you are, we want to help you. We really want to help you. And even if you don't seek help at your doctor's office and all, if you think that you can manage it, everything else up to that point, please do that. And please, 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 if you have any thoughts of suicide, okay, any thoughts, the number 1-800-273-8255. It spells talk. Okay. 1-800 is 24/7. It's available 24/7 for anybody who needs the help. Please, please use it if you having any issues. I don't care whether you're black, whether you're white, whether you're African, whether you're this and all that too. We all feel the same pain. We all feel the same pain. We go through different things in life, but we all feel the same pain. And for younger girls, I don't want to put too much into younger girls. Every younger people now, all the things that I just read before, and everything that we have to put up with in real life, school, the pressure from school, the pressure to look good on Facebook, the pressure to look. You see people, and one person has like 10,000 likes because they have a certain kind of body, and this one, all of that kind of, especially with young girls and very impressionable people, even older women. This is not just for young girls, even for older women too. They're like, okay, this and that. This person just had a baby, but it looked like they never even had a baby. But me, I had a baby, and this and everything else that comes along with it. Again, give yourself some grace. Get to a point where you be like, this is my body. This is who I am. I may not be the person who had 10,000 friends. 10,000 people may not like my picture or even comment on anything I wrote, because we live in a social media society. Whether we like it or not, we live in a social media society. Okay. And it affects us. I see people come into my office, and I can attest to that. Even in our real life, we all know that, you know. I was saying to my friend, I was joking. I said, "Oh, I had this outfit that I want to wear." I said, "But I can't post it because that means I can post it. I'll post it again. It'll be like, didn't she wear the same outfit before?" it's, and that's like, yeah, I'm thinking of like at my old age, seriously. But I know that in some of my clothes, I'm one of those people. I don't care. I got outfits on Facebook where I've worn it 3, 4, 5 times already. I look back, and I'm like, oh, okay, well, whatever. Chances are not too many people looking at it anyway, so they won't even remember. And if they remember, so what? I'm not going to take my clothes and wear it just one time. So you get used to that because it's going to be recycled. I've recycled a lot of stuff before, and I've had this conversation before about wearing the same clothes again on Facebook. So same clothes, the same shoes, they don't matter. And the good thing with me, I don't have 10,000 friends, so I'm good. All right. So but if you need to reach out to anybody, please reach out to somebody. Once again, the suicide hotline is there. Please, please write that down somewhere. Okay. You can also call 911 if you can't reach it. Just call 911. All right. So I hope everything I said to you today has helped somebody, or will help somebody who you love. Let me see my comments over here before I go. Alrighty, so Jackie Jackson say yes, yes, yes. Let me see. I'll also look out for cutters and other SIV signs. Can you kindly share other signs, please? Thanks. Like I said, I didn't want to, sometimes there are no signs. There are other, and I didn't want to go too deep into so many mental disorders and all. So, but I may add that to on Friday also. But it's so mental illness is so vast. That's why I don't want to put too much into it, because I've seen other podcasts and it's just too much for people, the general audience. There's also my friend on 2A Radio that did if 2A Radio is another forum that they talk about healthcare, some other NPs, and I also volunteer in there too. She had a whole show about mental illness, so she talked about all those different things. So if anybody wants to go and watch there, I think it was last week when she was on. Okay, and Jackie said unhealthy relationships also lead to depression, anxiety. Unhealthy relationships between mother and father, between spouses, between boyfriend and girlfriends, between children, between step parents, between half parents, between all of that. Sometimes even neighbors or crazy stuff, things that go on, excuse me, in life that can happen too. So making sure unhealthy relationships, sit down, talk about it. If you need to go to counseling, the other person may not see it the way you want to see it, and you have to just keep talking about it and making sure, like I said, speak. All right, so let me see what you said here. And finding a good support system. Okay, excuse me, mental health. Yes, yep. I think I got all the questions here. All righty, so I think I got all that. Let me go back to my banner. So for all of you who watched this time around, if you have any other questions, leave it there. I'm going to answer questions or comments if this I help you. And you, all the other new followers I got also, please click like, and click like, follow. Also, for those of you who only on YouTube, I'm also on YouTube. Just click join the subscription and turn on the notification buttons. And we'll be talking more about this, because mental health, it's a mental health awareness month. It's not just May. Okay, mental health occurs all through, and you notice whenever I talk about mental health and everything is I do talk more about mental health every time I add to that. Okay, so don't want to make this much longer. So thank you all for watching. For those of you who watch now, I say thank you, all my participants. And for those of you who will be watching later, I say thank you as well. And I will be on Friday at 7 o'clock, and I'll be bringing somebody who is a mental health person. She does work with substance abuse as well. So I'll be bringing her on Friday. She couldn't make it today. So I'll be bringing her on Friday. So until then, please stay safe, take care of each other, love each other. Okay. And I will be back next Friday at 7 o'clock. Maybe pop in before, but 7 o'clock on Friday. Okay. So thank you all for watching. I really appreciate it. Thanks for your love and support. Good night. God bless.